Good evening. Welcome to Monday's Late Look North. Tonight, heated debate in Huddersfield over controversial changes to hospital services. Good evening. There's been passionate debate at a public meeting in Huddersfield tonight over proposed changes to hospital services in the town. The local NHS trust wants to move all emergency care 5 miles away to Halifax, while Huddersfield would become a centre for planned care like routine surgery. Health bosses say it would improve patient care, but campaigners claim it could put lives at risk. Our health correspondent Jamie Coulson reports.
Hundreds gathered in Huddersfield for tonight's public meeting, many more than the venue could hold, and many of them were already concerned about controversial plans that would see all emergency care move from Huddersfield to Halifax.
I just think it's disgraceful that a town that size, this size, is not going to have an A&E.
Huddersfield's a big enough town to have its own A&E department, and I expect us to get one eventually as well.
You don't have support for these proposals.
Inside, there were passionate exchanges and a mix of emotions. There have been lots of questions tonight about the proposed changes, but inevitably a great deal of concern about what it'll mean for A&E.
I'm Dr Davis, I'm one of the consultants.
The two emergency departments currently provide a wide range of care, but they're struggling. They have half the recommended number of consultants and don't meet some of the national standards for children's or intensive care. So the plan is to centralise all emergency care on one site in Halifax, a decision that was ultimately taken because it would cost less than doing it in Huddersfield.
I can't say that anybody isn't going to come to harm because they've had to travel a little bit further. But what we do know is that people who travel further to a centre of excellence like we're planning, the outcomes are better.
But at tonight's meeting, not everyone was happy with the explanations that were given.
I'm an ex-nurse. I've fought for a long time to keep A&E and I will carry on fighting because they just blobbed over answers.
They've dodged the question, or they've answered something else, or they've made bland statements that mean nothing.
The public consultation will run for another 9 weeks before a final decision is made in the autumn.
Well, Jamie's in Huddersfield for us now. Jamie, clearly a lot of passion there tonight.
Yeah, well, it's all quiet here now, but as you say, lots of passionate exchanges earlier on this evening. There were questions about travel times between Huddersfield and Halifax. There were questions about how two towns with two A&Es could fit into one. And of course, the question about why a town the size of Huddersfield should be the one to lose its emergency care services. Now, throughout all of this, the local NHS has said that it's looked at all the options available to it, but that it genuinely believes the proposal it's putting forward is the best for patient care as well as the finances. But of course, convincing the public here tonight of that is a difficult matter. And after the meeting, I spoke to the chair of the Greater Huddersfield Clinical Commissioning Group, Dr Steve Ollerton.
I thought it was really hard, if I was going to be honest. I think it's quite difficult when you get your professional integrity questioned, but I'm passionate about these changes. I feel they still need to be made, and we may have to modify them, as I've said, but we need to change things to make things better for the whole population, and that's what I'm committed to do.
So the public consultation will now run until the 21st of June. This was the last public meeting, but there will be more drop-in sessions that people can go to if they want to find out more information about how the changes will influence them directly. After that, they'll gather all the information together, analyse it, and hopefully come up with a final decision sometime in the autumn. But clearly, based on what we saw here tonight, there are still a lot of questions that people have about how these changes could be good for them in the long run.
Absolutely, Jamie. Thank you very much. Jamie Coulson there in Huddersfield for us.